Induction of labor failed and nobody explained why. Let me break it down. You were induced, but nothing was happening. This is what they don't tell you. My name is Lucy, and if this is the first time you're seeing my face, thank you so much for watching my video. What is induction? After a woman who is pregnant have reached the age gestation of 40 weeks plus, it is always advised that you go to the hospital and meet your doctor so that labor can be initiated. So the process of initiating labor is what is known as induction. So I have like 6 basic reasons why your induction might fail. And the reason I'm making this video is because I want you to have that mindset of knowing that it is always 50-50. If labor did not start by itself and you reach the age gestation of 40 weeks and you are being advised by your doctor or your midwife to do induction, it is always 50-50. There is 50% chances that it will fail, and there is also 50% chances that it also lead to vaginal delivery. One of the basic reasons why it might fail, number one, is when the cervix is not ready. It is going to be hard and the cervix is going to be closed. Cervix is the mouth of your womb. If the cervix did not open, there is no way that baby can come out. So if the cervix is not ready, no matter the height of contraction you are having, the induction will still fail. Number 2 reasons is when the contraction is weak. We all react to drugs differently. There are some women that their body will not respond to drugs despite the amount and the duration this drug is being given. It will not do anything to them. And if you are receiving those drugs they're supposed to receive that will initiate labor, and you are having adequate contraction, but still the cervix is not opening, it means that that induction is going to fail. So if the contraction you are having is not all that strong to initiate cervical dilatation, then the induction will still fail. Because I have had an encounter with a woman that came into labor, and at the active phase of labor, I initiated oxytocin infusion. At 5 drops already, the woman's head is on fire. She was screaming, shouting because of pains. And I've also met a woman that at 40 drops, she still did not act as if she's receiving anything. So if your body is not responding well to the drugs, it will lead to weak contraction and you still end up in cesarean section. Number 3 reason is when the baby's head is too big or the pelvis is very small, the induction will fail, and this is known as CPD. Number 4th reason why after induction you still end up in cesarean section is when the baby is not in a good position. Instead of presenting with head, the baby might present with buttocks or with brow, which is forehead. You see that you end up in cesarean section. Number 5 reasons why your induction might fail is when you are not patient. If the induction is not giving a longer time to work, if you meet me in labor and you are to do induction, I will explain to you that you have to have patience because it takes hours, especially when you are first-time mother. It takes hours before the effect of the drugs will start working. So if you are so anxious to see your baby and did not give the process a due time, it will fail. Sometimes it will warrant 12 to 24 hours before it will start working. The induction will still fail. Then my number 6 reason why you still end up in cesarean section, why your induction might fail, is when that baby is in distress. If the fetal heart of that, if the heart rate of that baby is too high, like 160 and above, or too low, like 110 and below, it is an indication that induction will be stopped halfway, and you will be rushed to the theater to deliver the baby, because those signs are telling us what is happening inside the womb. Then if at vaginal examination your midwife or your doctor happens to see a meconium stained liquor, which is meaning that baby is already in distress, then that induction can be stopped halfway. So I'm here to tell you that the induction does not necessarily mean that you are going to deliver vaginally. If your case have reached the stage of coming to the hospital to do induction, always prepare for delivery and also for cesarean section. Whichever way that comes, you will now know that you will be very, very ready to face it up front. If you watch this far, please make sure you like this video and follow for more pregnancy and labor tips. Thank you so much. My name remains Lucy, your midwife and your correctness.